Are you feeling genuinely burnt out in your career and you're not sure how to self-advocate for yourself so that you can find a way to get some reprieve? Welcome to my channel. This is another episode of Ask Nurse Cheung, where I take your questions and I answer them here. Today's question begins: I am ready to quit this field. I am genuinely burnt out. I have been a medical surgical nurse for 2 years. What has gotten me to this point? It has to be the constant berating by patients. It has to be the constantly being yelled at by doctors for laughable offenses. It is the constant being told to do more with less. I'm just exhausted from this and I'm ready to leave. I understand the feelings of burnout and exhaustion that you're experiencing because I personally experienced it myself. It is a very difficult situation and one that many nurses are having to face right now in their careers. Self-advocacy is an important step in helping you find a place in nursing that's going to be more suited to your needs. You can think about changing the type of nursing you do. Look into things like ICU nursing, ambulatory care, or maybe even home health. You can also look at areas that are less stressful, such as public school nursing or public health nursing. At the end of the day, even with switching specialties, the same stressors will continue to happen in different forms in different situations. During the pandemic, I worked as a nursing educator. The unit was great. The people that I worked with was great. It was ultimately the management, the leadership, and the admin was not. When you don't feel supported by your leadership, you can get burnt out extremely easily. Not to mention the fact that we were going into a pandemic to the point where we had patients that were passing away every single day. And at some point, that does take a toll on you. So for all of my nurses that are out there that work the pandemic, I am right there with you. I know what it feels like. I know what it feels like not to be supported by your leadership. And I know what it's like to be a nurse and ultimately want to help people and not having the ability to do so because of something that was so devastating, such as COVID. So trust me, we've all been there. Not saying this is your experience, but just know that we've all experienced burnout in some way. From the perspective of self-advocacy, you're going to have to start off by asking yourself a few questions. When was the last time you've taken time off for yourself or a vacation? Many times when nurses find themselves being burnt out and they get into this kind of burnout mode, it can be attributed to the fact that they have not taken a break in a long time. I would speak with your manager and ask if you can get some paid time off sooner than later. If your manager decides not to approve your paid time off, I would consider if this unit is worth staying on. Another question you can ask yourself is in what ways have you taken care of yourself physically, emotionally, and mentally? Finding ways to de-stress, recharge, and re-energize will help you manage that distress of burnout and exhaustion. What I will say is that if you don't find effective coping skills now, the same exhaustion is going to come up again and again.
Thank you very much.
Some effective ways to help with stress can be self-care practices, right? If you enjoy meditating, journaling, or even exercising, which I know can be difficult when you have one day off in between shifts, because let's be honest, most of us are spending our time in bed. Maybe it's even eating at your favorite restaurant, having some kind of experience such as like going to a theme park. Try to figure out what works best for you. Another question you can ask yourself is, are you working in an environment or culture that's toxic? If that's the case, it's time to switch. Poor management, lack of resources, unapproved PTO, and coworkers can all contribute to feeling burnt out. If you wanted to stay at the bedside and have a new environment every few months, then I would recommend travel nursing. Lots of burned out nurses during the pandemic flocked to travel nursing because it's not so bad when you only had to be there for 3 months. As for dealing with difficult patients, the best thing that you can do is continue to be professional and stand your ground. Speak up for yourself and make sure that their behaviors does not affect your quality of care that you provide. No one deserves to be treated disrespectfully, not even by physicians. And remember this phrase: my patient's safety is my priority. If they continue yelling, then I would advise that you walk away from the situation, inform them that when they are ready and they have calmed down to have a good conversation with you, that you'll come back. These are the type of questions that I would explore and answer before making any kind of decision. So self-care is important and your needs are going to ultimately come first. You want to make sure that you're taking care of yourself at all times. If it's finding a new job, a new unit, or even taking a break from nursing altogether, which most of us did, you need to remember that you are worth it. And burnout can happen to anyone. With appropriate self-advocacy systems in place, you can use this as an opportunity to take care of yourself and start fresh. So take a moment, create an action plan that will help you move forward in the best way that you possibly can. The most important thing is to remember that you are not alone. And there are plenty of people out there within this community that is going to guide you. So I really hope that this answered your question. We have all been there. We are all burnt out. And for my newer nurses who haven't become burnt out yet, it most likely will come at some point. It just might take you some time. But trust me, that burnout is real. As for self-advocacy, what I would say is don't take any crap from anybody, right? Continue doing the best possible job that you can. And know that at the end of the day, you did your best, regardless of the way that patients or physicians or management or your coworkers or whoever has treated you poorly in your perception. Because it's all about our perspective. As always, if you have any questions, make sure that you reach out to me on all of my various channels. You can leave a comment down here, you can send me an email, or you can head over to www.nursecheung.com where there's a ton of additional resources that are available to you. As always, take care of yourself, and I will see you in the next video. Bye!